So, hi everybody, great to meet you. My name is Paul Donnelly. I am the UK and Irish Managing Director of Winback Medical. I was part of the original team that founded the company back in 2013. Basically delighted to be here and to be part of the HDPN educational network. We're a massive believer in education as a mechanism for understanding new technology and integrating new technology into your everyday practice. So I'm delighted that James has given us this opportunity to introduce ourselves. Essentially, we founded the company in 2013. We built it up over that period of time into now 25 countries around the world. About 7,000 private clinics and hospitals would be our sort of customer base, and we work in everything from acute, subacute and chronic injury management to pre-operative and post-operative care in the orthopedic and sports medicine fields. Three core technologies in our business. The first one being Techotherapy. So what is Techotherapy? So Techotherapy is a combination of manual therapy techniques, exercise-based recovery, and a high-frequency current that delivers an effect into the body that helps us treat acute, subacute and chronic injuries, whether it be muscle, tendon, ligament or bone. Very unique technology, used in combination and getting a lot of evidence behind it now as a frontline technology. So that's Techotherapy, and you'll see a little bit in the videos just how it's used in practice. The second technology in which we're really invested is in the area of strength and conditioning, and that is blood flow restriction technology. So BFR training or BFR rehabilitation is where we're partially occluding the inflow of blood back into the muscle, and we're creating a hypertrophy effect. Our technology is called smart cuffs. It's one of only 2 FDA listed technologies, and we're delighted to be bringing it into the UK and Europe. Recently, we launched the 3rd generation of smart cuffs, where we're using auto-regulation to take the limb occlusion pressure and also to exercise under auto-regulation. So the pressure within the cuff is continuously monitored through range of motion. Great technology. We believe it's very affordable, and we think it's a great clinic tool, but it's also a tool that patients can take home as well. So the smart cuffs is something we'll share with you on our journey. I guess product number 3 is in the strength and conditioning field as well, and that is the Kinet isoinertial flywheel technology. Flywheel technology really in professional sport and now more and more in the clinic and rehab world is really getting a lot of traction. And it's because you're able to, in one device, you can deliver a lot of exercise-based movement. You can load the tissue concentrically, and importantly, you can overload the tissue eccentrically, so that you have a combination of approaches that really give you a very profound effect on the rehab journey. So they're the 3 main technologies that you'll be seeing as we go through our journey together. Finally, education for us too is at the cornerstone of everything we've done. You know, we believe that as business owners we can relate to you very closely. We run this business 24/7. So innovation's at the heart of what we do, service is at the heart of what we do, but education really is the beating heart of the Winback company. And our Winback Academy, which is really an international group of 30 trainers who train across all our technologies, really are there to help you on your journey as you discover these technologies. I was struck by what James said about being evidence informed, and we believe a lot in that approach. By all means, study the evidence. You have to. Challenge the evidence, however, in the peer-to-peer setting. So ask the question, does the evidence work when n equals 1, when a patient walks in that door? And we encourage people to find the answer to that question really by talking within their peers and people who have adopted our technology. Finally, how do you get to try this technology in your clinical practice? So that's where we offer, particularly HDPN members, the opportunity not only to try the technology, but to be trained in the technology and then clinically assess the benefits before you make that important decision. So finally, in closing, great to be part of this journey. We're very much looking forward to meeting you one-to-one. Good luck this evening or today if you're going through one of the full-day programs, and I very much look forward to meeting you face to face. My thanks, and have a great one.